Sky News has witnessed some of the conditions that people in eastern Ukraine have been living in since the start of the war. Many have been sheltering in cold, damp bunkers for 2 months now, coming out only for food and medical treatment. Well, joining us from Lviv in western Ukraine is World Health Organization spokesperson Bhanu Bhatnagar. Really good to talk to you today. You saw a little bit there of Alex Rossi going into the underground bunkers. We saw in Alex's report that the hospital that he'd visited had been attacked 20 times and was attacked again just a short time after he left it. What is the latest that you know about the situation there in that area and that hospital?
Thank you. Yes, so WHO has been trying to reach that hospital. It's the only functioning hospital in Severodonetsk at the moment. We were able to reach with supplies. Recently, we had offered them a large generator so that they at least would have power to treat their patients. But in fact, the generator was so large that they were worried it would become an object of attack because it would have had to sit outside the hospital and would have been, you could have seen it from the air. So we instead gave them a smaller electric generator that they could place inside their basement so that they could continue to operate. We're talking about a pretty dire situation. There's about 100 patients still in that hospital. And as your reporting as your reporter has said, it's come under attack multiple times. Some doctors have left. We understand nurses are essentially taking on the duties of doctors. We also understand that the general community, the people in the community, are coming to help the hospital, to fix broken windows, to clean the hallways, so that it can continue to operate. But it's absolutely vital that there's some sort of a humanitarian ceasefire so we can actually get more supplies in. We also understand there's a lack of medicines, blood pressure medicines, simple painkillers to keep things like fever down. So it really is vital that supplies can get in.
And in terms of, you obviously want to get supplies in, but also there'll be people there who want to get out as well. What assistance are you able to offer?
So, as I said, we've been calling for a humanitarian ceasefire for weeks now. The Secretary General is actually in Ukraine at the moment, and we hope that there can be some sort of a humanitarian ceasefire to get people out of Severodonetsk, but also Mariupol, which has been besieged for so long. We, as WHO, as the World Health Organization, we need to be able to get inside to actually assess health needs. It's one thing moving supplies near to places that are seeing some of the heavy fighting, but we're, in a way, guessing what supplies are needed. And for the most part, I'm sure our supplies will be used, but we actually need to get inside to understand what the actual needs are. Are we talking about conflict-related injuries? Do we have people with non-communicable diseases or chronic conditions that need care, like diabetes, cardiovascular disease, cancer, HIV patients? So it's absolutely vital that there's some sort of a humanitarian ceasefire, and we need to see it for a minimum of 2 days so that supplies can move in and people can come out.
And how hopeful are you that any kind of humanitarian ceasefire can be reached?
So that's a political decision, as I'm sure you know, and WHO and other UN agencies continue to lobby and negotiate with all parties and to ensure that a humanitarian ceasefire can be agreed upon. As I said, the Secretary General is here, and his presence here is important. The UN is ready to mobilize the entire organization in order to get people out of Mariupol safely, but also ensure that supplies can reach safely to places that need it.
Well, best of luck with that. Bhanu Bhatnagar from the World Health Organization, thank you very much.